Hey, this is Dr. Keith Hersey, and you are listening to the Destroying Diabetes podcast. Hello, everybody. I'm back again. They didn't shut the doors and latch it up. They let me in. So I guess I can do another episode. I'm afraid one day I'll come in and the doors will be locked and everything be shut down and the power will be off. And then I'll know that they're finished with me doing podcasts. So thank you for joining us today. I have a special guest, Dr. Mariko Dove. She is in the area of Durham, North Carolina. She's worked in various settings. She worked in advanced community health pharmacy. She's also implemented clinical pharmacy services that include billing encounters, and also she's added such things as wellness visits and continuous glucose monitoring. And during the COVID-19 pandemic, she joined forces with other local pharmacists and administered initial doses of the COVID-19 vaccine for the community. She has a Bachelor of Business Administration, and also she has a Doctor of Pharmacy from Campbell University. Her particular area of interest is type 2 diabetes. She's worked in various settings as a specialist. She received the putting continuous glucose monitoring in practice certificate and the insulin therapy certificate, which further expanded her knowledge of insulin therapy options. And she's an active member of both the Association of Diabetes Care and Education Specialists and the North Carolina Diabetes Advisory Council. And she also enjoys meeting patients who has all types of questions. So if you have any questions, feel free to email us and we can address anything that might not be addressed during the podcast. And she also and I thought this was really, really nice. She has a medical appointments journal on Amazon, which you can get. And I think that's like pretty cool to have, so that you can or you can have, if you're a caretaker of a loved one, or you can have a loved one, bring that to their appointments to make sure that they jot down any important information, or if they have any questions, they can have them beforehand and ask them where they're there with their provider. So thank you, Dr. Dove, for agreeing to come on today. I just think that what we try to provide is information to type 2 diabetics, information that hopefully that they can use in their life to help with their condition. So I just see this podcast as just an outlet for providing information for the type 2 diabetes community. So again, thank you for agreeing to be on here today.
You're welcome. Thank you so much for having me and thinking of me.
Okay. And what initially, what sparked your interest in diabetes?
My family history.
You have relatives?
Yes. My great grandmother had diabetes and my grandmother has type 2 diabetes.
Okay. Okay. Yeah. So, yeah, there's definitely, unfortunately, they have the similar family history as well. And as I mentioned in the earlier podcast, my father was a type 2 diabetic. And so I grew up watching him inject himself with insulin, the old animal insulin, the pork insulin.
Okay.
So I grew up in that base, and then I'm being a type 2 diabetic myself, just wanting to keep that from going into the next generation. So that's what kind of inspires me. So, and then and since you've worked a great deal with type 2 diabetic patients, one of the things that we want to talk about is just mindset and just helping people that have type 2 diabetes. A lot of it is mindset that a lot of times when you get the diagnosis, it can be confusing, it can be kind of overwhelming. Sometimes people struggle and they may, give up on trying to make the changes that they need to make to enjoy a better quality of life. So what do you find when you were dealing with type 2 diabetic patients? What helped them, and what tips would you have for people listening to this podcast?
So I like to share whenever I come across patients that have type 2 diabetes. And like you said, it can be overwhelming when you get the initial diagnosis or just realizing that, oh, now I have to take insulin. I like to share a little inspirational story. And this is actually a true story. So the story goes something like this. There was a elderly woman, an older adult, who had type 2 diabetes, and she was not on insulin at the time, but she ended up having stroke number 2. She was hospitalized. After she was hospitalized, if I remember correctly, she was while she was in the hospital, she was started on insulin. After her discharge from the hospital, she went to a rehabilitation center. Well, after rehabilitation, she went home. She had a very supportive family. Her husband prepared her meals and was very conscientious about how he prepared the meals. He wanted the meals to be healthier. I wanted her to eat healthier. And she also was adherent to her insulin therapy and other medications that she had to take. She could not exercise because of the stroke, but she could do physical therapy. So the physical therapist would come out to her home and help her with it. So she was very consistent about those 3 things: having healthier food options, doing the physical therapy, and being adherent to her medication regimen. Well, she kept on being consistent. And eventually, after follow-up appointments with her healthcare provider discontinued their insulin. And that person is my grandmother.
Oh, yeah.
Yeah. So I like to share that story with patients because some of them realize, like, what? That was your grandmother? Well, if she can do it, I can do it too.
Yeah.
So, yeah. And then also patients that may be struggling to manage diabetes, I think that it's important for them to realize that they do not have to go at it alone. The ADA guidelines specifically state, and I quote, "People with diabetes should receive health care from a coordinated interdisciplinary team that may include, but is not limited to, diabetes care and education specialists, primary care and subspecialty clinicians, nurses, registered dietitians, nutritionists, exercise specialists, pharmacists, dentists, podiatrists, and mental health professionals," end quote. So for the people that are having the difficulty and feeling overwhelmed, if they have not met with some of these healthcare professionals that I just mentioned, then you really need to have a conversation with your healthcare provider and say, hey, I would like a referral to one of these people. And also realize that you don't know what you don't know. And you will be surprised at the wealth of information and resources and tools that you can obtain from these healthcare professionals, all to better manage diabetes. And I want to give this example. When I worked at the community health center and I would do continuous glucose monitoring appointments, I worked closely with the dietitian, and we would do warm handoffs to each other. Well, there was this one particular appointment where a patient had a question that I thought was best answered by a dietitian. So I had the dietitian come in during the appointment, and I listened to her counsel and educate this patient. And as she was doing this, I thought to myself, I probably need a dietitian myself. And I don't even have type 2 diabetes, but it was just amazing at the information that she gave him to help him make better choices, better informed choices to manage the diabetes. And then patients need to also, another thing you can do that may help minimize some stress is to write down your questions. And I know sometimes when individuals are out and about at the mall, at home, wherever, you think of all these questions like, oh, I should ask my doctor this when I go see them. And then you get into the office and then you forgot all of your good questions. So as you think about them, write them down, take the questions with you to your appointment. And then when your healthcare provider answers the questions, write their when they answer the question, write their answers down that they have said so you can always refer back to it. And then express your concerns to your healthcare provider. Let them know, like, I don't understand why this is happening. Can you explain to me about my medication? I have questions and concerns about it. I think I might be having side effects. Express your concerns. And if you don't feel comfortable expressing your concerns, or you feel like your healthcare provider is not sufficiently addressing your needs, then maybe you might need to find a different healthcare provider. Well, those are all things to take into consideration, especially for the patients that are just struggling and feeling overwhelmed with management of this type 2 diabetes.
Yeah, they're just excellent, excellent advice. And definitely, I would definitely recommend if you have type 2 diabetes that you work with a team. I have a nutritionist that I work with. So, and it's very helpful and very insightful, just the way food can affect your diabetes, positively or negatively. And so that's always a good idea. And then I know that you worked a lot with continuous glucose monitoring now, or people will say like CGM. What is that, and how does that work?
So CGM stands for continuous glucose monitoring. And the CGM device is essentially a device which you attach to your arm or your abdomen, which continuously monitors your interstitial glucose. And so I want to talk about why, CGM is so important to me. So it's important to me because I've seen the value of it. I have seen firsthand the impact that it has on the lives of patients. I consider CGM to be a game changer. I really cannot say enough about CGM. It is a game changer in the management of diabetes. And many patients love it because they don't have to prick their fingers as often to check their blood glucose. CGM is just way more convenient compared to blood glucose monitoring. With the blood glucose monitoring, you have to carry around the strips, the lancet, the monitor. But with CGM, you don't have to carry around anything extra if you have the app on your smartphone, because you'll already be wearing the sensor on you. And then the reader is on the app, which is on your phone, which you would carry anyway. But for persons that do not have a smartphone in which they can use the app, then they will need to carry around the reader. I love that the device will sound an alarm when the glucose drops too low or it becomes too high. And in patients where there is a concern for hypoglycemia or low blood glucose, this is extremely important because the alarm gives the patient time to respond to the low glucose event before it becomes a serious issue. I also love that patients can easily share the CGM data with caregivers. For example, if the caregiver has an app, let's say they stay, at a different house, well, they can look at their app to see how their loved one's glucose is doing. Is it going up? Is it down? Is it in range? What is it? And then if they notice that it's the glucose is dropping low, then they can, realize, hey, I think I need to check on mom like sooner rather than later to make sure, she handled that low blood glucose and to check on her. So I love that. I have seen patients get a sense of ownership and empowerment when they receive this CGM device and when they are educated on how to use it. The CGM trends and data obtained from the device are very useful when considering insulin dose adjustments and other medication therapy management. And there are trials which reflect that patients who wear CGM regularly, they have decreases in A1C as well as decreases in hypoglycemic events.
Oh yeah, yeah, definitely is a game changer. I started just as a personal disclosure. I started using CGM at the beginning of the year, and it has been it's just been like a like I said, it's just a game changer because you don't have to worry about pricking your fingers and keeping up with your monitor and your test strips and all that. And then you get instantaneous like results, and you kind of see like trends too. You can see how stuff is trending for a week or a month or 3 months or 6 months. So, and you also just get a good idea about what I find the most beneficial is that just how foods may affect like your glucose readings, and some things really spike it more than other things. And so this gives you like a good idea of like which foods to eat less of and which ones to eat more of to kind of blunt the spikes. So it is like just having that information, and then like I said, then of course the ease of providing that to your provider. So like when you go in for your checkup, you can just pull out your device and they can look at your readings, and they'll have, and for them, that's a good idea because it's showing you what it is over a period of time, not just, a periodic check here and there and stuff. So so it is such a game changer. I would definitely, like, if you're able to, do it, and if you make sure, if your insurance covers it, I would definitely, get it.
Yes, definitely. And I do want to add, so on the provider side, when I would do continuous glucose monitoring appointments, when I worked at the community health center, we had the remote access. So I could actually log in and check on patients. So I didn't have to wait for them to have a 3-month or 6-month follow-up appointment with their healthcare provider. If they granted me access to their device, I could log in, sometimes I may do every week to see how they are doing. And if I'm seeing that they are having a lot of hypoglycemia or low glucose events, rather than I could call on them and check on them and say, hey, what's going on? Are you, and make recommendations to their healthcare provider as needed. So I definitely love that remote patient monitoring capability.
And how do like if someone was interested in getting that, how would they go about it?
So first step, if patients that have type 1 diabetes or type 2 diabetes and using insulin, then the first step would be to talk to your healthcare provider and ask them for a prescription. Then the healthcare provider would send a prescription to your pharmacy. If there are insurance issues, normally the pharmacy will send something to your healthcare provider to let them know that they need to maybe complete some additional paperwork and get to the insurance. And then there may be some types of insurances that may require patients to use a medical supplier. If that's the case, then the healthcare provider would need to send a prescription directly to a medical supplier and make sure they include certain types of information on the prescription. And then if there are any listeners that are saying, I've done all of it, I've got the prescription, my pharmacy still won't fill it, I'm still having issues with the insurance, then they can definitely contact me for a paid consultation. And then I can step in to see, what piece of information is missing and how I can help them access the device.
Yeah, that's definitely good, because that's the biggest, the biggest hindrance is just trying to get through. Sometimes it's kind of a maze to get through the insurance, to get it to approve, to get the doctor to send the information in, and then get the right monitor, because some insurance will only cover certain monitors, and
Well,
finding out which one that covers and all that. So yeah, it's a little, but it's usually it's well worth it though. The benefit is such a thing that just having to put up with a little bit of a maze to get one shouldn't let you stop you from getting one, because it is so, the benefits of it is so great to me. So
yeah.
okay, so I think that's really just great information that you're providing our listeners, and it's something that's really beneficial. And it just before we sign off, I just how can people contact you, or if they wanted to use your expertise, or just have questions?
So healthcare professionals can contact me on LinkedIn. Just type in my name, it should come right up, Mariko Dove. And then potential clients or patients, they can definitely reach out to me just DM me on Instagram, and I can contact them or send them a booking link. And my Instagram handle is Dr. Mariko. And it's Dr. DrMarico, Mariko.
All right. Well, we definitely will have that, or any other information want to provide. We'll have that in the show notes as well. So if people don't get it right now, they'll be in the show notes if they want to contact you. And I just would like to thank you so much for just coming in and giving some information to our audience. I just love passing along information, because there's so many people around here that are just experts and can provide insight, maybe something that maybe someone hasn't thought of, and you can provide that information. And just like information is just power. If you're armed with the right information, then you can become like a better advocate for yourself. And that's important, no matter what health condition that you had, or even if you're perfectly healthy, is being your own advocate.
Definitely.
Well, thank you so much. I really, appreciate you coming in, talking with us, and I hope, don't be a stranger. I hope to have you again and provide more information.
Okay. Well, thank you again for having me. You take care.
All right. Thank you so much. All right. So thank you, Dr. Dove, for being on the podcast today. If you have any questions or information, like I said, we'll have some information on the show notes. And thank you for listening. And we really appreciate it if you could like this podcast, rate the podcast, spread the word to your friends and family, that we have some good information on here. And we appreciate your support. So until next time, you have a good week, weekend, life, wherever. I'll talk to you soon. Thank you so much.
You're welcome.